Hello, everyone. We are so glad you are here today. We have a fantastic webinar for you, Communicating with My Healthcare Provider. I know I should communicate with my healthcare provider, but why is it so difficult? A little bit of information before we start. All attendees are in listen-only mode. If you cannot hear, hopefully you can read this. So click your audio button on your personal computer to assure that the sound is on. Sometimes that's the issue. Hopefully you can hear us. Please type your questions into the chat box at any time during the presentation. The moderator will read your questions during the question and answer period after the webinar. So make sure you get us those questions. And then a PDF version of the slides, as well as the recording of this presentation, will be available on the Mended Hearts and the National Lipid Association's website following the event. A handout is also available in the handout section of the website. So you have all this good stuff for you, even a little video. So you have plenty of resources for you. So a little bit about the organizations. We have Mended Hearts, and our mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. The National Lipid Association's mission is to enhance the practice of lipid management in clinical medicine. And the foundation of the NLA's mission is to improve the welfare of patients and families affected by cholesterol and triglyceride problems. I am really happy. A friend and a wonderful healthcare provider is here to talk to you today, Lynne Braun. And she is Professor Emerita at Rush University, and I'm Jody Smith, the Program Director for the Mended Hearts, Inc. So without further ado, Lynne, take it away.
Great, Jody. Thank you so much. I'm thrilled to be here. And I'm particularly thrilled because this is a joint effort between two organizations that I love very much, Mended Hearts and the National Lipid Association. A little bit about me. My background is that I'm a nurse practitioner and I'm Professor Emerita at Rush University. My clinical practice has been in preventive cardiology, where I work with people to help reduce their risk factors, both in terms of lifestyle changes as well as medication if necessary. I have volunteered for numerous organizations throughout my career. In particular, I've held leadership roles at the American Heart Association as a volunteer, and the National Lipid Association. And I'm proud to say that I've spoken for Mended Heart groups in the Chicago area a number of times. So again, I'm thrilled to be here. Let's see if I can try and advance the slides here. Great. I have only one disclosure. I'm an author for Up to Date, which is a medical reference that we use clinically. And because of what I've written, I do receive just some minor royalties from them. Here are our objectives for today. First and foremost, I want to talk about shared decision-making and why it's important. Shared decision-making is between a healthcare provider, whether it's a physician or a nurse practitioner or a pharmacist, as well as the patient and family. I'd like to describe how best you, the patient, or a patient can prepare for the visit with a healthcare provider. We're going to talk a bit about health literacy and why it's important in understanding one's health condition and treatment plan. And then also the importance of having a very good relationship with, yes, of course, your primary healthcare provider, perhaps your physician, but also with the entire healthcare team, because sometimes it really takes a village. Okay. Shared decision-making is the process through which a patient and clinician jointly makes a healthcare decision. So together they meet to make that decision. It's no longer patriarch. I'm struggling with the word patriarch. Where
Patriarchal.
the physician, sorry, where the physician directs that conversation. And I can't think of the word, I apologize. It's a joint effort. It's a partnership between the healthcare provider, the clinician, and the patient. And together you talk about treatment options based on the most current research evidence, benefits versus risks for a treatment, and then what you, the patient, would really values. These slides appear to be advancing without me. So if we could go back one, Jody, are you able to bring us back one?
If you right click on it, you can hit previous. I'm afraid to touch it.
Okay. Now that doesn't seem to be working.
Okay, let me do it. Yeah.
Okay.
Here we go. There we go.
All right, great. And the other thing that this partnership does is it helps a person review information or assess information that they have read or spoke to somebody about with support from health professionals. So very, very important. Let me see now if I can move forward. I think I'm going to have to ask you to advance.
Okay, not a problem at all.
It doesn't seem to be working for me.
Sure.
So the one back again.
There you go.
Thank you. The benefits of shared decision-making are that a patient has greater insight into the disease process and associated risks. And because if the patient is part of the decision, he or she will likely have better treatment adherence. There is a buy-in on the part of the patient, whether we're talking about lifestyle changes or medications. And very often, something I like to do with my patients is self-monitoring. So whether this is a person who has diabetes and is self-monitoring blood sugar, if it's someone who has high blood pressure and they're self-monitoring blood pressure, if it is someone who is engaging in lifestyle changes and they're using a wearable to provide feedback on physical activity, or perhaps using an app to enter dietary information, that's all part of self-monitoring. It provides immediate feedback that then the patient can share with their healthcare provider. It also teaches problem-solving skills, and we know from research evidence that it improves health outcomes. Next slide, please. I also want to make you aware that shared decision-making is part and parcel with our clinical practice guidelines. When we practice, we have recommendations from national organizations like the American Heart Association or the American College of Cardiology. And in the various guidelines, and this is an example of the primary prevention guideline, there are recommendations related to shared decision-making. For example, next slide, please. If you look at the second recommendation here, this is from the primary prevention guideline. The second recommendation, which was awarded the highest level of evidence, is shared decision-making should guide discussions about the best practices to reduce cardiovascular disease risk. ASCVD is an abbreviation for atherosclerotic cardiovascular disease, or in other words, cardiovascular disease as a result of blockages or plaque deposits. So shared decision-making is part and parcel. You can also see that the guideline recommends a team-based care approach, and that we as providers should be concerned about social factors, and we call them social determinants of health, whether or not someone has adequate access to care, access to healthy foods, good housing, etc. All these things affect our livelihoods, our level of wellness, and our ability to obtain health. Next slide, please. In 2018, and I was part of this guideline as an author, we published a cholesterol guideline, and we have shared decision-making in that guideline as well. The recommendation there states that clinicians and patients should engage in a risk discussion that considers risk factors, adherence to healthy lifestyle, the potential for ASCVD risk reduction benefits, and the potential for adverse effects and drug-drug interactions, as well as what you, the patient, prefers for an individual treatment decision. So a lengthy discussion between the clinician and the patient about these very important topics. Next slide, please. This is an example of how we start. So if I have a patient who does not have known heart disease or ASCVD, as we would call it, but has risk factors, I would start with saying, Mr. or Mrs. So-and-so, let's estimate what your 10-year risk is for having a heart attack or a stroke. And I would plug in all this information, their age, their sex, their race, their blood pressure, their cholesterol values, if they have a history of diabetes or not, and whether or not they smoke. And then the calculator, the risk estimator, comes up with a percentage. In this case, it's close to 8%, 7.8%. And I'd say, Mrs. So-and-so, your risk is 7.8%. Let's round that up to 8. And what this means is if there were 100 people like you who had your same risk profile, about 8 of them in 10 years are estimated to have a heart attack or a stroke. Is that acceptable for you? Or what can we do to change it? And we would talk about lifestyle, ways to lower cholesterol and blood pressure, and potentially medications to do the same. And certainly if somebody smokes, this individual happened to be a never smoker, but her risk would be way higher than 7.8% if she was a smoker. So we would talk about how we can alter this risk of 7.8%. Next slide, please. The cholesterol guideline has a table on shared decision-making, and some of the key points are to encourage you, the patient, to state what you heard. What is your personal risk for having a heart attack or a stroke? What are the available options we talked about? What are benefits and risks? And I, the clinician, need to invite you to ask questions, to express your values and preferences, and to state your ability to adhere to lifestyle changes and medications. I would refer you to trustworthy materials to supplement what we talked about, and then also to collaborate with you to determine what your treatment plan is going to be, as well as a follow-up plan. Next slide, please. I don't want to belabor this, but there are decision aids out there. This one is by Mayo Clinic, and it's a decision aid to help people decide if they wish to start a statin or not. This happens to be someone who currently has a 6% 10-year risk for having a heart attack or a stroke. And that's what those highlighted orange dots are. And if they start on a statin, it shows that in the next 10 years, only 5 people would go on to have a heart attack or a stroke. That's just a difference of 1. And we would talk about, is that something that's acceptable for you? Is it worth it to start on medication? Next slide, please. Okay, so this is all good information, Lynn, but I still have difficulty communicating with my healthcare provider. Let's talk about how you can do it better. Next slide. It is really important to prepare ahead of time for a visit with a healthcare provider, I feel. I'm better at what I do if my patient comes in prepared, because I want to meet their needs. So you, the patient, should set an agenda, write things down, and bring that list of medications and supplements with you. But really write down what your concerns are as well. And remember that office visits may only last for 15 or 20 minutes. So it's important to prioritize your concerns. If you have 10 things on your list, identify, I would say, your top 3, because most likely you're not going to be able to discuss 10 of them with the healthcare provider you are seeing that day. Probably 3 would be a very, very good start. And then conclude the visit with, okay, I have more questions, I have more concerns. Should I schedule another visit, or should I communicate with you in another way and find out what they have to say? But during that visit, it's important for you to take control and introduce your concerns at the start of the visit. But at the same time, be aware that your healthcare provider may first need to review some of your chart information, your health information from the electronic medical record, just to kind of get them back up to speed from the last time that you were seen in that office. Next slide, please. Also, it's important for you to learn how to assess your medical record via the patient portal. I think that I would be very surprised if practices did not use an electronic medical record or health record now. And they all have a patient portal where you can access information. And most electronic systems now allow you to actually review notes from the previous visit, as well as your test results and medication, other things. So try and review it prior to your appointment so that you're really updated on your previous visit, as well as any current test results or anything else that might be pertinent for that day. Some people find it helpful to bring in a medical binder that includes tabs for key information like their upcoming appointments, what their medications are, including dosages and frequency, any test results, requisitions for future tests, and maybe even hospital discharge summaries that they like to keep. Some people like to keep all the hard copies of pertinent health information. Some people, like many of my patients who were very particular, like to create spreadsheets to follow the pattern of test results, whether it's blood pressures or heart rates, if they were exercising maybe, nutrition information or exercise data. Next slide. Just to reemphasize though, if you're concerned, you will forget to give your healthcare provider key pertinent information during your visit, make sure that you come in with notes. Make sure that you write it down, type it out or write it out. And sometimes, I mean, if this requires a lengthy description, actually give it to them after you've talked about it, because that will help your healthcare provider enter it into your medical record as you would like it to be entered into your medical record. You know, what is truthful for you. Next slide, please. Be open and honest. It's okay to share worries and concerns, and we want you to do that. Share information about your lifestyle, any family obligations or relationships, because really all these things affect your wellness, and they're going to affect your ability to engage in a particular treatment plan. It's okay if you had a goal that you said you were going to work on from the last visit and you didn't meet that goal. That happens to all of us. It is okay. Please be honest and discuss the reasons why maybe you didn't meet that goal, because now something new may have come up, something that is very important to share with your healthcare provider. And don't be fearful that that we're not interested in your personal situations or struggles, because we absolutely are. It's so important that we have a full picture of your overall well-being, including lifestyle factors, because as I said, these contribute to your overall health, and they're very important for us to be a part of as well. Next slide. A good relationship is key. And I don't know how to say this without sounding negative, but if you don't have a good relationship with your main healthcare provider, then find one that you can have a good relationship with. It is just so important. Someone who gives you the time and is empathetic. You should feel comfortable discussing most anything with that individual. You should be able to discuss pain or any other feelings that are bothering you. And it's our role to empathize and provide a level of comfort and to help you feel better and to partner with you to create strategies or solutions that will help you through whatever that health situation is. Next slide. I want to spend a few minutes talking about the notion of health literacy. Health literacy is the ability to obtain, process, and understand health information. Next slide. Sometimes when you visit a healthcare provider, they may actually give you a brief screener to assess your health literacy. And it includes some basic questions like, how often do you have someone help you read or understand hospital materials? How often do you have problems about learning about your medical condition because of difficulty understanding any written information that you're given? How often do you have a problem understanding what is told to you, the verbal information about your medical condition? And how confident are you in filling out medical forms by yourself? So this may give us, and again, please don't ever, next slide, please. Please don't ever be embarrassed, because understanding the language of medicine or healthcare can be a challenge. It's natural to feel unsure or overwhelmed. Often we use too much medical jargon for a symptom or a diagnosis or a test result or what the treatment might be. Don't be afraid of being perceived as being unintelligent. And, you know, afraid to admit that you don't understand what is being said. So please ask questions and clarify words you don't understand. I have had patients who are brilliant in their chosen field. Brilliant, absolutely brilliant. But when it comes to understanding my field of healthcare and medicine or nursing, they need help. And we talk about things in different ways, and we repeat a lot of things. I ask them to say it back to me, what they heard me say, etc. So it's, you know, it's strange. It's like it would be me trying to understand legal forms and other kinds of information that are not part of my field. Next slide, please. So ask questions. If you're given too much information or it's too complex, ask questions to gain a clearer understanding. And if you need to clarify, you can ask in a nice way. You can say, I'm not following you. Can you please explain it in a different way, in another way? And then repeat it back. I heard you say that because I had a heart attack before, my cholesterol level right now is too high and it puts me at risk for having another heart attack. Is that correct? So, put it in your own words, paraphrase it, and say it back so that your healthcare provider knows that you understand. Next slide, please. I have a couple examples here. This is just an example of a patient who had a heart scan, a coronary artery calcium scan. So one healthcare provider is giving a result. Mr. So-and-so, your CT scan showed that you have atherosclerosis in your coronary arteries. It's important that you take the statin medication to lower your cholesterol. Period, end. That might be okay for some people, but most people, at least my patients, need more information than that. So I might say something like, Mr. So-and-so, your heart scan shows that you have a calcium score of 100. We can see these bright spots on the image of your heart, and I can show a picture. The bright spots mean that there's calcium in one of your heart arteries. When there's calcium in the arteries, it means there are plaque deposits, and we call this atherosclerosis or coronary artery disease. It's so important now that you really eat a very heart healthy diet and that you exercise regularly. But I also do recommend that you take a moderate dose of a statin medicine, since it will lower your cholesterol and prevent that plaque from getting worse or progressing. Let's talk about a statin medication. I'll explain it to you and I'll tell you what the potential side effects are. And then I'd like to hear your thoughts and answer your questions about it. Next slide, please. So I may be the other end. I may be a little bit wordy with my patients, but usually they come away with pretty good understanding. Asking questions, again, is very, very important. You need to be sure that your healthcare provider hears and understands what you told them. And if they choose not to focus on it and go off in a different direction, bring it up again. Say something like, my home blood pressures are higher than they used to be, and I'm concerned about this, whatever the issue might be. Don't be afraid to re-emphasize your concerns if they aren't being addressed. Bring the conversation back to what your concerns are. Ask about the best way to communicate any additional questions. Remember, we started out by saying that you might only have 15 or 20 minutes, if that, with a healthcare provider. So, you need to prioritize what you talk about, but you may have more questions or more concerns than that is. Ask the best way to ask those, to follow up with those questions. Is it another visit? Is it communicating through the patient portal in writing? What would be the best way to communicate those additional concerns? Next slide, please. And then ask about resources to learn more. Does your healthcare provider offer any educational materials? Many office settings do, and some come from these very reliable websites. I have listed on this slide, and I heard that you're going to have a copy of these slides. So I have the educational portal or link site for mendedhearts.org. I have learnyourlipids.org, which is the educational site from the National Lipid Association. Heart.org, Health Topics, is from the American Heart Association. And then cardiosmart.org is from the American College of Cardiology. All of these sources have pretty amazing educational materials. Also, you may want to talk about how to identify misinformation, because if you just search for something on the web, you may come, like if you put in statin medication, oh my gosh, you're going to get a ton of people who are against taking statins. And, and it's important to identify fact from non-fact, on these various websites. So what is the best way to identify misinformation? Again, oftentimes my patients will write it down or print it out and bring it to me at the next visit, and then we'll talk about it. Next slide. Just trying to stay on a timetable here. So consider bringing a family member or friend to your visits. It's very, very helpful. It's helpful to have a second set of ears to hear what you're being told. And then while you're discussing your concerns, that person might serve as note taker too. So that's helpful. I know that during COVID, typically in outpatient visits, and certainly even with hospitalized patients, visitors were not allowed, or even a second person was not allowed. So it's, I've become, just to share a personal situation of mine, I've become a caregiver of my husband because he was recently diagnosed with Parkinson's disease. And during COVID, sometimes I would be able to attend and sometimes I wouldn't be able to attend. So we would do two things. I would type something out for his neurologist or his primary care provider from my perspective as someone living with him, and he would give it to them. And then secondly, he would call me and put me on speaker, and I would be part of the conversation. So that worked both ways, worked for us. Next slide. Again, your healthcare team, your entire healthcare team, your primary care physician or nurse practitioner or PA, your specialty physicians, etc. They're, you're working with them as partners. You're the center really of all that they are doing. It's all about you and achieving your optimal health and quality of life. You're in the middle, you're central to that team. You're an active partner. Together, you should decide on a treatment plan and share any concerns that you might have about cost, preferences, etc. Next slide. Who's your healthcare team? Well, it can be small, it can be very large. Often it's your primary care physician, any specialty physicians. If you're seen in an academic medical center, you will often have care by residents or fellows who are training to be specialty physicians. You may see a nurse practitioner or a physician's assistant as your primary care provider, or you may see them instead of a specialty physician in a particular office. Sometimes appointments might be altered, with the physician and then with the nurse practitioner the next time and back to the physician, etc. Because it does take a team, and one person often cannot see all the patients that they really want to see. Typically, if you make a phone call into the office, you're talking to the office nurse. So it's important to have a relationship with the nurse that works with your main healthcare provider. When you come into the office, you're seen by a medical assistant who works with that physician or nurse practitioner. So it's important to have a relationship there as well. You often might be referred to a dietitian or an exercise specialist. So they're part of your team too. The pharmacist, if you take medications, it's good to have a relationship with your pharmacist. Sometimes even with a mail order pharmacy, you can have a relationship. If you're in the hospital, very often a pharmacist will round with the physician and nurse practitioner PA group, and they give recommendations on choices of medication, what some of the drug interactions could be, etc. A social worker, a psychologist could be could be part of your team as well. Next slide, please. Remember that a treatment will best work if you feel that you had a stake in the matter. You were included in that decision. You're a partner in your care, and you understand and agree with the plan of care. Again, you know, you're the center. You're a partner in making that decision. Next slide, please. I wanted to bring your attention to a book. The second editor, Beth Myers, is a former colleague. She and her partner, Wendy Benson, wrote this book called The Confident Patient. And I've given this book to many people, and they have felt that it was especially useful, you know, for people who have chronic illnesses, people who, or if they're caregivers for people with chronic illnesses. One of the quotes from the book is that confident patients have the ability and motivation to know what questions to ask so that they can become more familiar with their current medical status. So why a test might be ordered, what exactly the results mean, what are the various treatment options, etc. The more you know, the more confidence you have. Next slide, please. And it's important that all of us continuously focus on our health. So I have here the diagram from the American Heart Association for Life Simple 7. Life Simple 7 are 7 health factors or behaviors that bring us closer to ideal cardiovascular health. So those little pictures mean going clockwise, healthy blood glucose level, consuming a heart healthy diet, being at a healthy weight, engaging in regular exercise, abstinence from smoking or using other tobacco products, having a healthy blood pressure, and having healthy cholesterol levels. And then to complement ideal cardiovascular health, it also includes stress reduction, good quality sleep, which is very, very important to heart health and health in general, adequate hydration, having healthy relationships, being in a safe environment, avoiding communicable diseases, and engaging in preventive measures and routine appointments, not just going to see your healthcare provider when you feel ill, but making sure that you have regular checkups, if you will, regular physical examinations, regular blood work to identify earlier rather than later when something may be wrong. Next slide, please. So in summary, I think it's very important that we understand that shared decision-making is important for me, the healthcare provider, and you, the patient. It's important on both ends, and and it's important that you know that you're a partner in your care, and I want you to be part of that decision with whatever we move forward with in terms of treatment. It's also important to prepare in advance for your healthcare visit, to have a prioritized agenda, to review notes and tests in your patient portal ahead of time if you're able to do that. To be open and honest with your healthcare provider, ask those questions that are pertinent to your situation, your condition, to be sure you understand and know what your treatment options are. Ask about resources to learn more about your condition. Develop a relationship with all members of your healthcare team. Obviously, typically there's a quarterback. There is a primary care physician or nurse practitioner, or sometimes a specialty physician can serve in that role and kind of can coordinate care among other providers. But you're the one that's most important and should have a relationship with whomever is involved in your care. And then do all that you can to keep yourself healthy. Next slide, please. I think this is my last slide. So my take-home message here, and this is I'm paraphrasing something from the book, The Confident Patient. It can be challenging to be confident when communicating with a healthcare provider. Having a plan, knowing what questions to ask, developing a list of support systems to have in place, and becoming familiar with resources can help build confidence in communication with a healthcare provider or your entire healthcare team. That is it. That's all I have, and I'm happy to address any questions now.
Lynn, that is so wonderful. I mean, such a good amount of information. And so if you have a question, you can type into the Q&A box and we will read it out. And we have a couple questions for you already, Lynn.
Are they going to tell me how to pronounce paternalistic? That I was struggling
oh, it's
with
paternalistic.
Okay. Yes, paternalistic.
Yes. No. I was trying to figure out where you were going with that, but yeah. I get it now. Yeah.
Paternalistic.
Yes. One of the questions we had ahead of time is about telehealth and how that has changed communications. You know, a lot of patients are feeling like they're on a telehealth appointment and it's not as comfortable asking questions and engaging more with their care. What would you suggest to people in telehealth appointments?
I think it would be the same thing, really. You know, that's an appointment like an office appointment would be. It's important to prepare ahead of time. You know, and that's a situation where you can certainly have somebody else present. And they can also, you know, help out with that situation and perhaps, you know, answer some questions too. But I tell people to prepare for a telehealth visit just as though they are coming in. I'm not sure if the person who asked this question wants to provide additional information on why they don't feel that they're getting as much. Obviously, a full physical examination can't be done, but you would be surprised to know how much we can see, you know, when you're engaging with that person. You can notice body language, and that may clue the healthcare provider into something that could potentially be wrong. You know, if this is someone who is having maybe a heart failure exacerbation, maybe they are retaining lots and lots of fluid. The ability to communicate may be affected. You know, someone may be short of breath just in talking, or someone may look puffy to that healthcare provider, and that healthcare provider can say, you know, we really need to see you, or I want you to go to the emergency department. So, you know, yes, there are limitations with telehealth, but there are ways to kind of get around things and address things as well.
Yeah, I think that sometimes patients feel like it's not as the relationship isn't, you know, when you're in person, you develop more of a relationship with the team, and you're just seeing the doctor and not seeing the whole team, and so that can be a very different experience.
That's certainly true. And I think it depends on who you're seeing for telehealth. If you're seeing some type of substitute, you know, for your primary, you know, for your physician or whoever you've been seeing on an ongoing basis, then yes, there could definitely be a limitation there.
Yeah, absolutely. And there's a question in the Q&A about whether the calcium scan is covered by insurance. And I really think, I mean, you will know better than me, but I really think it depends on insurance company to insurance company and state to state, even for that one.
So what's going on with that now is the coronary calcium scan has been labeled a screening test. And screening tests are typically not covered by insurance companies. And as a result, most organizations have tried to make them very affordable. In the Chicagoland area, typically it ranges anywhere from like $59 to maybe $150. And you can kind of search around as to who has that $59 scan. But there's movement. There's movement in Medicare and insurance companies to try and cover it and to try and make it not label it as a screening test so that it would be covered.
Right. Thank you. That's really helpful because I would like to get one myself. I always when you work for a heart organization, you think of the 20 million things you want to check on in your own heart, right?
I know. And I wanted to, part of the problem is, we do CT scans for many purposes. And this is actually a CT scan with a low level of radiation. It's about as much radiation as a mammogram. But there's a much fancier CT scan that is done to look at the heart. And in fact, it's a substitute for a cardiac catheterization. And that type of CT scan costs a couple $1,000s if you had to pay for it out of pocket. So I think for a while there was some confusion about what this was versus what that was.
Right. Well, good to know. Someone asked, the nurse who answers my doctor's email and phone calls has been very unhelpful. She refers me to a list of doctors instead of having a preferred doctor who has an opening sooner than July. What can I do? Good question, Laura.
Yeah, that's a very, very good question. So, so the nurse answering, so she is emailing or she's messaging her physician about something, but and needs some information from that her main physician. And the nurse is replying, and instead of and her appointment with that physician is July, and she's giving her oh my goodness. Okay, I'm just trying to clarify that.
Yeah, I think she's being referred to other doctors in the practice who are not her, preferred doctor, the doctor she normally sees. And her doctor probably doesn't have anything till July. And so they keep referring her to these other doctors first, kind of situation.
Yeah. You could try that. I mean, if there is no other way to get through, it sounds like her message is not getting to her own physician, because odds are, if it does, that physician will figure out a way to work it in. If her situation is urgent enough, that physician should see her on a more timely basis. I don't know what to tell you about how to get through to that physician. Obviously, she doesn't have a phone number for a direct phone number for that physician, right? Yeah. I think I would keep that appointment, that July appointment, but I might also schedule an appointment with one of these other physicians in the interim. If my concerns were immediate enough, I think she doesn't have a choice but to give it a chance. And, I mean, things have happened where she might be very happy with or be very satisfied with that encounter. I would also ask if a video visit was possible with your own physician, and some type of a telehealth visit earlier than that July appointment, because very often practices are able to do that. You might also see if there is an advanced practice provider in the office that you can see in the interim. So that would be a nurse practitioner or a physician's assistant who works directly with your physician. I'm biased, obviously. I'm a nurse practitioner, but you may be able to get some satisfaction from that appointment, and that person would have direct communication with your own physician.
Yeah, and it was suggested in the chat box she changed doctors as well, but and it might
or
come to that.
or that,
Yeah, and yeah, I used to have a doctor where you could never get in, and you couldn't even get a sick visit. And I think that sometimes you do need to change doctors, sadly. But it's
sometimes you
hard
do.
to develop that relationship again.
Yeah.
And I had a friend, I'm not recommending this necessarily, but I had a friend who told the front office that she was going to keep calling every 2 hours until she got an appointment that was
Yeah.
earlier. But it was a pretty serious situation that she was dealing with.
Right.
So,
right. And sometimes there's such incredible limitations set on us that on the poor patients who are trying to reach someone to help them. I would hope that, oh my gosh, I feel bad that the nurse, that the nurse just keeps feeding her non-helpful information. Although maybe she might like one of those physicians better than her own. Who knows, right?
Possibly.
Yeah. And I don't know. I assume she's not only messaged, but also called.
Yeah. So anyway, a lot of thoughts, and one person suggested in the Q&A that some of the practices are getting so big, and I know this is true for a lot of practices I go to, that they have an answering service and you don't get to a person. Like, you cannot get to a person. They leave a message for whatever doctor, and that is really frustrating. I will tell you what.
It is very frustrating. It is very frustrating. And my advice there is to, whenever you receive surveys, to fill those surveys out, make sure, because, in my practice, we get our Press Ganey scores on a very, very regular basis. And they tell us, and it's written exactly what the patients say. And I know for those surveys too, there's information about the practice and the organization and the access and all of that kind of information. So absolutely fill that out. Contact the patient relations department of the hospital too, because I have seen them intervene in situations like this a lot, whereas they will then communicate directly with the practice and say, hey, this is unacceptable.
Yeah, absolutely. And also, you can try, if you have a patient portal, you can try messaging them directly in the patient portal. But I find even that the nurses are answering there and not the doctor. And I know,
depends on how it's set up.
right.
In my practice, that is in fact the case. It's the nurse who works with me who gets it before me. She tries to answer, but very often, she has a very short, very often she would then, if it's my patient, she would then send it to me or to the physician. She will, if it appears at all that the patient is dissatisfied with her response, she doesn't think twice about sending it on.
Yeah. Well, hopefully we'll have some resolution for our poor patient.
I know.
But another question, and this came up on a group of a very diverse group of patients, and some of them said that they were really afraid of being seen as the problem patient if they ask too many questions or keep voicing their opinion or so forth. So I don't know if you have any thoughts about that.
They shouldn't be, or please don't be concerned about that, because if whatever clinician you're seeing, whatever healthcare provider you're seeing, gives that air, or, if you're feeling that that you're being perceived as the problem patient, that's very unfortunate, and something should be done about that. Questions are so incredibly important. That is important feedback to us, whether or not we're being clear in our explanations, and whether or not we're including the patient in the decision. It's so important. So don't be concerned about be the problem patient. That's okay, as long as you're the most important person there, and it's so important that you feel satisfaction and get your health concerns taken care of and get your questions answered. So don't worry about that. Don't worry about being the problem patient. And if you get the impression that you're being perceived that way, and therefore you're not being treated well enough, then talk to the nurse manager. Then, do whatever you have to do to get satisfaction.
Yeah, well, thank you. That is, yes. And so, I think some people, it depends on your background and how you've been related to the medical field in the past. Like, I think some people are really scared and nervous and don't want to speak up. Well, other people have no problem speaking up, so it just depends on your comfort level and experience, for sure.
That's true. And it's why it's important to prepare for that visit. Yeah. And to come with things written down, because some people freeze. They say, oh my God, I had so many questions for you and now I can't think of any. Yeah. And I always tell them, and I tell them how, when they are on their way home and they think of questions, how they can reach me, and how we can address them at a later point then. Yeah. It's because people do get nervous about that visit, and they're not able to often convey all that they want to convey. So that's why I always tell people, or I'm telling you today, that make sure you walk out of there with the best mechanism to reach your provider after the fact, if you didn't get all your concerns answered, or if you think of something later on.
Yeah, and that really is key. And some will give their text number, which is really awesome. And some you have to go 3 ways to whatever to get to them. So anyway,
and try, I talked about the healthcare team, and and that's part and parcel with our guidelines too, that very often one person cannot meet all of your needs. So hopefully, if there's a physician that you see and they have a regular nurse who works with them, it's critical that you develop a relationship with that nurse as well, because you're going to be talking to him or her a lot.
Yeah, absolutely.
And usually first.
Yes, for sure. Well, Lynn, this has been absolutely wonderful. We really appreciate it. We're also very thankful to Aspirion and Novartis for supporting this whole series and allowing us to bring this to you. And again, this is hosted by the Mended Hearts, Inc., the National Lipid Association, and the Foundation of the National Lipid Association. If you have any more questions, we are going to be sending you out a follow-up email where you'll get the slides, you'll get all sorts of good information. So don't worry, we're available to answer any questions you have. We really appreciate you being here, and we hope to see you on future webinars. Thank you all so much. Thank you, Lynn.
Thank you, Jody. And I'm happy to help with any follow-up questions that come as well.
Yes, well, thank you. That would be great.
Take care now.
Okay.
Thank you, everyone. Thank you.
Bye.
Bye-bye.